All right. Peace and power and elevation. This your girl Tiffany coming through here live in effect. So I am finishing up what I did previously in my early video, which the topic was about eugenics and sterilization of black women for sterilization. So I'm going from that to talk about gynecology and peace, brother Chauncey. How you doing? And I'm going to talk about gynecology, Marion Sims, and the iatrophobia. Iatrophobia is a strong distrust in medicine and doctors. Okay, so as black people, collectively we have what's called iatrophobia when it comes to going to doctors appointments and things like that. And the reason why, because of a lot of unethical medical practices that has been taking place. All right. And so, but it's very common, especially amongst black men. Most black men don't like going to doctors, going to a doctor's appointment, getting checkups, none of that shit. Most of them don't like doing it, okay, because they have a very strong distrust with doctors. And black women, we don't feel very comfortable going, but we will go if we have to. Like, we ain't got no choice. But for the most part, we feel uncomfortable going. So, anyways, let's go ahead and let's get into all of this. So I want to get into some sources that I have, okay? All right, so let's talk about all right, so let me put up this article about black iatrophobia. Okay. All right, so as you can see, here's the article. All right, it's called publicsource.org, How History and Privacy Policies Inform My Decision to Be Wary of a Routine Doctor's Visit by Donnie Crawford. And this came about February 27, 2018. So it says, I have a confession to make. It has been a decade since I've had a routine physical exam. I'm almost too embarrassed to admit that year after year I intended to go see a physician, but I never picked up the phone to schedule the appointment. It's hard to admit this because I am privileged enough to have access to health care, and I personally know family and friends whose routine exams have saved their lives. I occasionally ask myself why I have been reluctant to schedule the exam, but I think I have subconsciously known the answer for quite some time. It seems the past is playing a role in why I've been avoiding the doctor. A few years ago, I learned a term to describe what I might be experiencing while reading the award-winning book, Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present. It's called Black Iatrophobia, and the author, Harry A. Washington, defines it as the fear of medicine presented in the Black community as a result of long history, involuntary, unethical, and non-therapeutic treatment by medical professionals and institutions. Okay, so that's that article, right? So that's that article that goes into astrophobia. All right, so because as Black people, we've been dealing with a long history of Ethical medical practices. That's one of the reasons why we don't like going to doctor's appointment. We don't like to schedule none of that. We don't even like talking to doctors. We don't like telling doctors about our medical condition. Okay. So it's a fear that's been going on with us for a long time. So now let's look at the book called Medical Apartheid. Well, okay, I'm gonna show you the title of the book, and I'm just gonna read the intro. All right, so Medical Apartheid, the dark history on medical experimentation on Black Americans from colonial times to present. All right, so let me go into the introduction. It says the American genus of medicine and race. Science without conscience is the sole perdition. Francois Rabelais Pantagruel. On a sylvan stretch of New York's Patrician Upper Fifth Avenue, just across from the New York Academy of Medicine, a college in marble August inscription and a bas relief caduceus grace a memorial bordering Central Park. These laurels venerate the surgeon James Marion Sims, MD, as a selfless benefactor of women. Nor is this the only statuary erected in honor of Dr. Sims. Marble monuments to his skills, benevolence, and humanity guard his native South Carolina State House, its medical school, the Alabama Capitol grounds, and a French hospital. In the mid-19th century, Dr. Sims dedicated his career to the care and cure of women's disorder and opened the nation's first hospital for women in New York City. He attended French Royal. His Grecian visage inspired oil portraits, and in 1875 he was elected president of the American Medical Association. Hospitals still bear his name, including a West African hospital that utilized the eponymous gynecological instruments that he first invented for surgeries upon Black female slaves in 1840s. Okay. All right, so then it goes down. Let's skip down. All right, so now it says old measures of health not only have failed to improve significantly, but have stayed the same. Some have even worsened. Mainstream newspaper and magazine often report disease in ethnocentric manner that shrouds its true cost among African Americans. For example, despite the heavy emphasis on genetic alignments among Blacks, fewer than 0.5% of Black deaths, that's less than one death in 200, can be attributed to hereditary disorders such as sickle cell anemia. A closer look at the troubling numbers reveal that Blacks are dying not of exotic, incurable, poorly understood illnesses, nor of genetic disease that target only them, but rather from common alignments that are more often prevented and treated among whites than amongst Blacks. Three times as many African Americans were diagnosed with diabetes in 1993 and in 1963. The rate is nearly twice of that white Americans and is sorely underestimated. The real Black diabetes rate is probably double that of whites. As with most chronic disease, African Americans suffer more complications, including limb loss, blindness, kidney disease, and terminal heart disease. Cancer, the nation's second greatest killer, is diagnosed later in Blacks and carries off proportionally more African American than whites. African Americans suffer the nation's highest rate of cancer and cancer death. It says the distortion of African American death rates is illustrated by the common dismissal of Black women's breast cancer risk as lower than white women's. This characterization implies that Black women are at low risk from breast cancer, but their risk is only slightly lower, because the estimated lifetime risk of developing breast cancer is 10 per 100 for white women in 1980. And 7 per 100 for Black women born that year. Moreover, this lower risk of developing breast cancer is overshadowed by Blacks' much higher risk of dying from it. 86% of white women with breast cancer are alive 5 years later. Only 71% of Black women survive that long. A Black woman is 2.2 times as likely as white women to die of breast cancer. Black women have been undergoing mammograms at the same rate as white women, but are more likely to receive poor quality screening, which may not detect a cancer in time for a cure. A Black woman is also more likely to develop her cancer before age 40, too early for recommended mammograms to catch it. And Black women are diagnosed at a more advanced stage than either Hispanic or white breast cancer patient. Black breast cancer patients have a worse overall prognosis prognosis, yeah, and worse prognosis at each stage. Black men have the nation's highest rates of developing and dying from prostate and lung cancers. And they also say, despite its image as a disease that affects middle-aged white men, heart disease claims 50% more African Americans than white, and African Americans die from heart attacks at a higher rate than whites. African Americans are more likely to develop serious liver ailments such as hepatitis C, the chief cause of liver transplant. They are also more likely to die from liver disease, not because of any inherent racial susceptibility, but because Blacks are less likely to receive aggressive treatment with drugs such as interferon or life-saving liver transplant. Even the legion of newest illnesses, emerging disease such as HIV, AIDS, and hepatitis C kills Blacks at much higher rates than whites. AIDS, the scourge of our time, has become a disease of people of color here and abroad. 49% of HIV infected African Americans are, let me read that again. 49% of HIV infected Americans are African Americans, and 86% of children with AIDS are African Americans or Hispanic. Blacks are 10 times as likely to develop AIDS as white. Say mental alignment are destroying Blacks as well. Black women suffer the highest rates of stress and major depression in the nation, and suicide rates soar 200% among young Black men within just 20 years. And speaking of suicidal rates, lately there's been a lot going on, especially with Black males. Let's see, the one that's been going around lately was the one about a guy in Phoenix where he had shot his girlfriend, and the baby was left in the house. He called the police and told the police there was something wrong with the baby. And when the police got there, he started shooting at the cops, and he turned around and killed himself. So with that being said, there's a lot of the mental illness crisis going on amongst Black males. As of lately, they're either not just killing their significant others, but they also killing themselves. Okay. And many of them don't want to seek help for their mental problem either, because they don't feel secure enough to do so. So just like many of us women who don't want to seek help for our mental problem, we try to find a way, and our escape is either suffering in silence, in depression, or doing drugs. Yep. So it's a lot of information in this book. Let's scroll down. Let's scroll down to chapter 1. So again, this book is titled Medical Apartheid. Southern Discomfort, Medical Exploitation on the Plantation. Celia's child, about 4 months old, died last Saturday, the 12th. This is 2 Negroes and 3 horses I have lost this year. David Gavin, 1855. So Frederick Garnier, or Gardner, a pure was it pure was it puropathic, a puropathic Mormon physician, left among his travel memoirs an impression of the 19th century slave markets of Washington, D.C. There are a great number of Negroes, nearly all of whom are slaves, and on different streets are large halls occupied as marts or stores for the sale or purchase of slaves. While I have been looking at one of these places on Garvier Street, 2 gentlemen have arrived, one of whom I have seen in the saloon. He is a young planter and come to purchase a girl to take care of his children or whatever duties he may think proper to impose upon her. The other person is a doctor whom he has brought with him for the purpose of examining her. They pass along the front of the road in company with the agent or salesman. As they move forward, one is called upon to stand up, then another while a passive examination is made. Then finally, he discovered a bright mulatto who appears about 16 years of age and is quite good looking. She is ushered into a private room where she is stripped to a nude condition and a careful examination is made of all parts of the body by the doctor and is pronounced by him to be sound. The money is then paid and she is transferred to her new owner. I have heard that the masters beat and screwed them most cruelly, but I have not seen anything of that kind, nor do I believe that it occurs very often, for the Southern people as a class are noble-minded, kind-hearted people as can be found in any country, and moreover, it would be against their own interest to brutally treat their slaves, as no planter desire to have sick Negroes on his hands. According to my judgment so far as my experience extends, I believe that the Negroes as a class are far more humanely treated and taken care of than are the laboring classes of European countries. All right, then let's go further down. Enslavement could not have existed and certainly could not have persisted without medical science. However, physicians were also dependent upon slavery, both for economic security and for the enslaved clinical material that fed the American medical research and medical training that bluster physician professional advancement. Gardner's Vinage suggests the integral role of medicine in enslavement and repeats a key belief that slave owners and physicians share an interest in preserving the slave's health, as no planter desired to have sick Negroes on his hand. But although medicine was essential to enslavement, the apparent solitude for the health of slaves were not all it seemed. Rather, the medical interests of the slave were often diametrically opposed to the interests of his owner and of American physician. From the first, antagonism reigned between African Americans and their physician. Between the 17th century advance of African settlers to North America and the end of 19th century, the slave and the physician shared an unrecognizable primitive medical world. The germ theory that revealed the microbial nature of much disease and led to the first grand waves of disease cured was still well in the future. The existence of pathogens such as bacteria, viruses, and fungi was unsuspected. Almost no effective treatments existed for prevalent disease until the 18th century. Until the late 1830s, the lack of effective anesthesia made the few common surgical procedures horribly painful and all others impossible. All right. So I won't go any further into this book, but just to give you the idea of what this book is about. So this book goes into the unethical medical practices that has been taking place in America. Okay. And also, if you notice, a lot of Black people, right, suffer from tuberculosis during the 20s and 30s, and they did not receive proper health care for that. So tuberculosis was a serious epidemic at that time. A lot of it came from the conditioning of the environments, which most of them was impoverished, lack of resources. Okay, they was living in contaminated environments. So with that being said, many of them did not have the adequate resources or the proper health care to go to the doctors and whatnot. Again, and when they did go, they didn't get the proper treatment. So just based on that history alone is the main reason why many Blacks do not trust doctors. All right? They won't trust the doctors. Okay. So before I go into the study, I want to read some comments on here. Linking on slavery, I have no purpose directly or indirectly to interfere with the institution of slavery. Linking on slavery, what I would most desire would be the separation of the whites and Black races. U.S. abortion 2008 equals 360,000. Oh, yeah. I'm going to get to that topic about abortion by itself. That's going to be a hot topic. Maya Angelou supported Black genocide in 2010 with one speech. Maya Angelou praised Margaret Sanger's Planned Parenthood and raised $300,000 for their chapter in San Antonio. Oh, that's something new to me. Didn't even know that. Higher than deaths from disease, accident, and crime combined, Blacks are disproportionately impacted by abortion, while representing 14% of American women. Blacks accounted for 35% of abortion. Oh, like I said, that's gonna be a topic in itself. But you know why so many Planned Parenthoods in our community, right? So many Planned Parenthoods in our community because it's to encourage us to continuously to depopulate our community. That's all it is, whether we want to believe it or not. But again, that's going to be a topic by itself, just by itself alone. All right. Just by itself alone. So I will be dealing with that topic, abortion, just abortion alone. Okay. So now let's go to the next one. So this comes from the ncbi.nlm.nih.gov. Understand African Americans' view of trustworthiness of physician. All right. So here it is. This came out in 2006, June of 2006. It says many scholars have written about the historical underpinnings and likely consequences of African American distrust in healthcare. Yet little research has been done to understand if and how this distrust affects African Americans' current view of trustworthiness of physician. It says to better understand what trust and distrust in physician means to African American. That's the objective. All right, so right here where it says result, participant indicate that trust is determined by the interpersonal and technical competence of physician. Contributing factors to this trust in physician include a lack of interpersonal and technical competence, perceived quest for profit and expectation of racism and experimentation during routine provision of healthcare. Trust appears to facilitate care-seeking behavior and promote patient honesty and adherence. This trust inhibits care-seeking, can result in a change in physician and may lead to non-adherence. All righty. So let's go down here. It says, so interpersonal trust between physician and patient has been shown to be an important determinant of care. Greater interpersonal trust has been found to be a significant predictor of acceptance of recommended care, satisfaction with care, loyalty and satisfaction with the physician, self-reported health improvement, and willingness to give the physician control in the relationship. While most research on interpersonal trust has focused on Caucasian patient views of the trustworthiness of healthcare are likely to differ for African Americans, given the historical legacy of mistreatment at the hands of the medical profession, witnessed the Tuskegee syphilis experiment and current health disparity. So, in multivariate analysis, Keogh found that African American patients were less trusting of their physician regarding a payment method than were their Caucasian counterparts. Another study did not find differences by race. This lack of consistency may be due to the fact that these studies focus on trust and not distrust. Studies that have focused on distrust have shown significant differences between African Americans and Caucasian in their distrust of the motives of the medical profession in withdrawal of life-sustaining technology, pursuit of organ donation, research, and healthcare overall. All right. So, of course, then when they did the method, they focused on 9 groups that were conducted with a convenient sample of participant recruited from a public hospital clinic and a community advocacy organization in Chicago, Illinois. All right. So they said 5 of the 9 were with African American women and 4 were with African American men. Okay. All groups were homogeneous by gender. Female and male recruited separately by gender matched African American research assistants. Okay. So the female participants were African American and at least 40 years of age. Males were African American and at least 18 years of age. Participants were excluded if they did not self-identify as African American, did not meet the age requirement, were unable to consent because of mental or other impairments, and could not participate in one of the scheduled focus groups. All right. So now let's go down. So let's go down to the results right here. So as you can see, this is the demographic, right? So the demographic characteristic of the sample. All right, so it says demographic characteristic, 32 women and 34 men participated in the study. The mean age of the women participating was significantly older than that of male participant. The majority of participants had completed high school, but the men were significantly more likely to have entered college than the women. More than 80% of all respondents have seen a doctor in the past year, and there were no significant differences in the annual number of visits made by males or females. More than 60% of subjects in both groups had either private or federal insurance coverage. There were no significant gender differences in insurance status or type of insurance. Okay. All right, trust in healthcare providers. So we explore participant views about healthcare providers by asking questions about what made them trust doctors. In addition, we asked if there were certain characteristics of doctors, such as race, ethnic background, that made them more trusting of physician. Common themes regarding trust in physician were similar across genders. Participants indicate they trust physicians who demonstrate interpersonal and technical competence. All right, so as you can see, the trust is interpersonal competence and technical competence. Distrust, interpersonal incompetent, technical incompetent, foreign physician, focus on profits, racism, expectation, experimentation. Okay. So now they say interpersonal competence is interpersonal competence include the common themes of physician caring and empathy, taking the time to listen and honesty, keeping the patient's best interest at heart. The following quotes are representative of each of these things. So my doctor was so gentle, I just gained trust in her through her conversation and her care that it felt to me that she just really cared about my problem and my pain, that I had experienced everything like that. And she gave me a guarantee almost that I wouldn't go through those pains again. And to me, I just learned to trust her and seemed like to me she was the one that I looked to that really cared about me. All right. And it says, doctors should be able to communicate and have a good bedside manner. Take that extra time, take that extra maybe 5 or 10 minutes. I may not mean an awful lot to the doctor referred to as you. Just show me that you are concerned. You know, you don't have to sit in the room with me for 20 hours. Make me feel comfortable because this is my life and I want to trust. All right. And so discussion and conclusion. Okay. So the African Americans in our sample revealed that the trust and distrust in physician are complex constructs, while interpersonal and technical competence drive African Americans' trust in physician. Distrust is more complex and arises out of more than incompetence. The participants in our study indicate that perception of physician greed and racism and expectation of experimentation in route medical care contribute to their distrust of physician. Not surprisingly, distrust negatively relates directly to the acceptance of or yet of and willingness to seek health care. So basically, all right, just to sum that part up, many of them want to be able to go to doctors that can relate to them, that can understand, that really cares and know how to communicate with them, and not just rush through the process or try to just get rid of them or try to dismiss them. So if they feel like that there's nobody who give them some sense of urgency or some sense of care, then they're not going to want to go and they're not going to want to be bothered with the doctors, period. So most of us prefer to have doctors within our own community, and doctors who really understand, know the historical horrific events that have taken place with us, and know how to be able to communicate with us properly, and know how to be able to get us in a comfortable state so where we can feel comfortable enough to trust that doctor and be able to talk to them. So for me, in my past, right, when I went to doctor's appointment, some of the doctors were like from other racial backgrounds, but the ones that I mostly dealt with was Black doctors. And so for me, it felt kind of good to be around a Black doctor, because particularly a female doctor, because the last time I went was when I had to go get the pap smear. Okay. So that's been a long time ago. Yeah, I had to go get pap smear, and I went to the doctor, and the doctor happened to be a Black female, which that was a cool thing. And the nurse was a Black woman, which that was cool. You know what I'm saying? So I'll go there, I get my little appointment or whatever. We chop it up. We having a good conversation. And so she was, taking a little easy on me while we talking and while I was going through that pap smear process. So ladies, the pap smear is very important. It's very important to have a pap smear. It really is. So whether how we feel about it or not, because we have to check and make sure we don't have cervical cancer, ovarian cancer, or any form of STDs or whatnot. Yeah, trust me, it's not a very comfortable process to go through. So when I got mine done, I was able to get the plastic. They use a plastic kind on me. It's versus the metal, because I wasn't going for that metal. For one, I don't know if they sanitize that shit or not. You know what I'm saying? They probably ain't properly sanitized it. So you using the metal kind on someone else, and then we don't know if you done sanitize that shit. We don't know if it's properly clean, and you trying to put in somebody else. Nah, give me the plastic kind. You know what I'm saying? That metal kind is uncomfortable. I tried that shit. That shit is uncomfortable. So the plastic kind is a lot easier, and it's not as bad. You know what I'm saying? So I went through that procedure before, and yeah, I went through the pap smear, and it wasn't too bad. You know what I'm saying? So, but you got to make sure you be consistent with that kind of stuff too. So I haven't been consistent like I should have, but yeah, you gotta be consistent. You gotta be able to go and get it like every 2 or 3 years. You're supposed to get pap smear like every 3 years or something. Yeah. You got to. You gotta be on top of that. But yeah, again, we want to be able to trust those that can relate to us and that can properly communicate with us. That's within our community. Mm-hmm. Yep. All right. So now let's go into this next subject matter. We want to talk about gynecology and Marion Sims. Okay. So, and speaking of gynecology, like I was saying, pap smear and all of that, that's part of gynecology. And a lot of us women, we don't like pap smear. We don't like to go get our vaginal checkup. We don't like doing it. Okay. We don't. And this article here, which is come from Black Perspective, aahis.org, right? This website here is going to explain why we don't like to go get no vaginal checkups and all those examination. Okay. All right. So let's look at it. So now right here in this article, as you can see, this is a mother. She looked like she's pregnant. She has 2 children. And I'm guessing this is somebody who's doing the research or something. Okay, so it says public health doctor giving tenant family medicine for malaria near Columbia, South Carolina. So malaria was a serious disease at the time period. And shout out to brother Darren Milton. Shout out to brother Darren for sending me information on malaria and sickle cell anemia. So one day I'll hopefully get him on here and we can have that discussion about malaria, because malaria was a serious disease here in America. So if you caught malaria, that means that basically, okay, so malaria is a disease that has a lot to do with mosquitoes. So because we get a lot of mosquitoes out here in the South, you know what I'm saying, and depends on the environment that we in, especially in the hot climate, right? That's when the mosquitoes really come out. Yeah, if you get stung by a mosquito, you gotta be very careful because they carry malaria. Okay. And so, and a lot of time when you get stung by a mosquito or when you get bit by a mosquito, it's a female mosquito. So what they do is they feed off the human blood, and that's how they survive. They survive off the human blood. Yeah. Yeah, but yeah, make sure yeah, you gotta be careful. So yeah, that disease, malaria, was nothing to play around with because people died from that. Um okay, there we go. Oh, all right. So right here, it's called, in her new award-winning book, medical Bondage, Race, Gender, and the Origins of American Gynecology, historian Diedrich Cooper Owens described the experimental work of early gynecologists, including Dr. James Marion Sims, the father of modern gynecology. Beginning in 1844, Sims famously performed his experiments on enslaved women in Alabama, including Antarctica, Lucy, and Betsy. Antarctica, Lucy, and Betsy, who he leased for the purpose of gynecological experimentation, repeatedly performing his crude experiment without any form of anesthesia as he attempted to be the first to repair vesico-vaginal fistulae. Owens writes that after 5 years of medical experimentation, Sims performed his 30th surgery on Antarctica and successfully repaired her fistula. Thanks in large part of his experimentation on enslaved black women, she adds, Sims has established himself as one of the country's preeminent gynecological surgeons less than a decade after he began his gynecological career. Due to his experimental procedure on enslaved black women and subsequent rapid advancement in the field of gynecology, Sims eventually served as the president of the American Medical Association in 1875 and the American Gynecological Society in 1879. Right? Okay, so, and it says, with her concise scholarly monogram on history of American gynecology and the exploitation of enslaved black and Irish women's body in the early to the mid 19th century, Owens centers medical case narratives, patient histories, and procedures transcribed in medical journals and judicial cases from appellate courts, physicians' daybooks, as well as formerly enslaved women's narratives to better encapsulate the ways that Black and Irish women experienced professional medical care and racism before the American Civil War. These primary sources, Owen writes, are just as important as plantation records, ledgers, and interviews in what they reveal about doctors' objectifying attitudes towards slaves and poor immigrants. Of her 5 chapters, 4 revolve around enslaved Black women. She relies on scant archives of medical journals, textbooks, and hospital records to piece together a comparative history of Irish women's racialized medical experiences in the mid-19th century in her 4th chapter. So, and then it goes on to say the medical bondage joined a growing body of work committed to center Black subjectivity, expanding and understanding of the social construction of gender and Black femininity beginning in enslavement and revisiting slavery capitalism. With her work, Owens also offers a jarring counter narrative about so-called great white medical men. Recently, historian Diana Ramey Berry expanded the historiography of slavery and capitalism with her groundbreaking work, The Price for Their Pound of Flesh, the value of the enslaved from womb to grave in the building of a nation, where she documents 4 external values attributable to the enslaved, including the ghost value of the Black cadaver or deceased yet insured enslaved body in an early chapter of Black on Both Sides, A Racial History of Transidentity. C. Riley Snorton explores the relationship between sex and under-gender flesh, utilizing Sims' archives as a materialized scene of female flesh ungendered. All right, so it says, distinct from these aforementioned works, Owens' book set out to specifically advance the historiography of slavery and medicine, and to also humanize the experiences of enslaved Black women who were, as she writes, both subjects and objects. To narrate her thesis, she relies on the term medical superbody, a concept she employs throughout to characterize the multiple, often contradictory meanings of enslaved women's medical experiences that produce invaluable foundational knowledge for white doctors, yet continually relegate Black women to the realm of subhuman and naturalized servitude. The great contradiction of the history of American gynecology argues Owen argues is how deeply the groundbreaking knowledge of early gynecology depended on enslaved bodies deemed inferior, inherently flawed, and culpable, and how this history has eclipsed the exceptional knowledge produced through Black women's body and the expertise of Black midwives. With her argument, Owens entered the theoretical and philosophical conversation of earlier scholars such as Michelle Rolfe Trulot, Charles W. Mills, and Black Susan Buck Morse, whose writing over the last 20 years have raised crucial questions about history and power, the silence within historical narratives, and the silence within silence, as Trulot has written. Owens entered this conversation with a marked understanding that history is the fruit of power, its ultimate mark being invisibility. All right. So it goes into the book about the medical bondage. So I really don't have to go into detail on that book because this article pretty much explains that. So yeah. Let me go ahead and share that book with you guys. All right, so the name of this book is called Medical Bondage, Race, Gender, and the Origins of American Gynecology. Okay. Whew. And so this article here, which I am not going to, I'm gonna skip this article, but I'm gonna show the article at the same time. This article is called Racism in the United States and the Reproductive Health of Black Women. Okay. So this article came out October the 10th of 2019. Okay. So I won't go any further into it, but if you guys want to check it out, it's called exploringhealth.org, Racism in the United States and Reproductive Health of Black Women. Okay, so let's get into who this J. Marion Sims guy is. Okay, so again, he was the so-called father of gynecology. Let's go into this man. So who was he? So Jane Marion Sims was an American physician in the field of surgery known as the father of modern gynecology, but also as a controversial figure due to ethical questions raised by how he developed his techniques. His most significant work was the development of a surgical technique for the repair of vaginal dyslucia, a severe complication of obstructed childbirth. He also is remembered for inventing Sims speculum, Sims sigmoid catheter, and the Sims position. However, as medical ethicist Baron H. Lindner states, one would be hard pressed to find a more controversial figure in the history of medicine. So it goes on to say Sims developed his surgical techniques by operating without anesthesia on enslaved Black women. in the 20th century, this was condemned as an improper use of human experimental subject, and Sim was described as a prime example of progression in the medical profession made at the expenses of a vulnerable population. Sim's practices were defended as consistent with the U.S. in the era in which he lived by physician and anthropologist L. Lewis Wall. And according to Sims, the enslaved black women were willing and had no better option. Sim was a voluminous writer, and his published reports on his medical experiments, together with his own 471-page autobiography, have been the main source of knowledge about him and his career. His positive self-presentation has, in the late 20th and early 21st century, been the subject to revision. So he was born in Lancaster County, South Carolina. Okay. So he was born in South Carolina. All right. So let's get into how he get involved in this. All right. So it says that for his first 12 years, Sam's family lived in Lancaster Village, north of Hanging Rock Creek, where his father owned a store. Sims later wrote of his early school days there. After his father was elected as sheriff of Lancaster County, he sent Sims in 1825 to the newly established Franklin Academy in Lancaster. In 1832, after 2 years of study at the predecessor of the University of South Carolina College, where he was a member of the Euphratean Society. Sam works with Dr. Churchill Jones in Lancaster, South Carolina. He took a 3-month course at the Medical College of Charleston, predecessor of the Medical University of South Carolina. All right. He moved to Philadelphia, Pennsylvania in 1834 and enrolled at the Jefferson Medical College, where he graduated in 1835. And lackluster students who show little ambition after receiving his medical degree, as he put it. I felt no particular interest in my profession at the beginning of it, apart from making a living. I was really ready at any time and at any moment to take up anything that offered or that held out any inducement of fortune, because I knew that I could never make a fortune out of the practice of medicine. He returned to Lancaster to practice after his first 2 patients died. Sam left and set up a practice in Mount Midge near Montgomery, Alabama. All right. So in 1837, Sims and his wife moved to Macon County, Alabama, where they remained until 1840. He was a plantation physician who had a partnership in a large practice among rich plantation. Sims became known for operation on club feet, cliff palates, and cross eyes. This was his first experience treating enslaved black women who were brought to him by their owners. And in 1840, the couple moved to Montgomery, Alabama, where they lived until 1853. There, Sim had what he described as the most memorable time of his career. Within a few years, he had the largest surgical practice in the state, the largest practice that any doctor in Montgomery had ever set up to that time. He was immensely popular and greatly beloved. Okay, so background: the use of enslaved people for medical research was uncontroversial in the antebellum South. A prospectus from the 1830s of the South Carolina Medical College, leading medical school in the South, pointed out to prospective students that it had a disadvantage of a peculiar character. No place in the United States offers as great opportunity for the acquisition of anatomical knowledge, such as being obtained from among the colored population in sufficient numbers for every purpose, and proper dissection carried on without offending any individual in the community. All right. The college announced in advertisement in the Charleston papers that it had set up surgery operating room for Negroes and offered to treat without charge while it was in session in any interest cases sent by their owners for the benefit of instruction of their pulpits. They extended the offer to free person of colors. The advertisement in by pointing out that their sole objective was to promote the interests of medical education. All right, so that was his office right here. Okay, right here in Montgomery, Alabama, that was his office. All right, so let's go on to say where in Montgomery, Sims continued treating slaves who made up 2/3 of the city's population. He built a hospital for the slaves he bought or rented and kept on his property. He had been called the first woman's hospital in history. In 1845, he was brought a woman with a condition he had not seen before, the vesico-vaginal phallus. In the 19 in the 19th century, vesico-vaginal phallus, though not fatal, were a common socially destructive and catastrophic complication of childbirth. They affected many women. There was no effective cure or treatment. Lacking adequate birth control, women generally had a high rate of childbirth, which increased their rate of complication. Vaginal phallus occurred when the woman's bladder, cervix, and vagina become trapped between the fetal skull and the woman's pelvic, cutting off blood flow, leading to tissue death. Ooh, and the necrotic tissue later slough off, leaving a hole. Following this injury, as a urine forms, it leaks out of the vaginal opening, leading to a form of incontinence. Because a continuous stream of urine leaks from the vagina, it is difficult to care for. The victim suffers personal hygiene issues that may lead to marginalization from society, and vaginal irritation, scarring, and loss of vaginal function. Sim also worked to repair retrovaginal phallus, a related condition in which flatulence and feces escape through a torn vagina. Ooh. Oh my God. Hold on. Hold on. Retrovaginal phallus. A related condition in which flatulence, flatulence or flatulence and feces escape through a torn vagina. Ooh. So in other words, what they're saying is when you passing gas and you shitting out your vagina. And leading to fetal incontinence. So that means that instead of you shitting out your ass, right, you shitting out your vagina and you passing gas out your vagina due to the fact that your pussy hole is torn up. I mean, I have to translate it in that manner. That's disgusting. It sounds very disgusting, but that was the condition at that time. All right, so anyways, in the mid 19th century, gynecology was not a well-developed field. The practice of examining the female organ was considered repugnant by doctors in medical school. Doctors were often trained on dummies to deliver babies. They did not see their first clinical cases of women until beginning their practices. Sim had no formal background in gynecology prior to beginning his practice in Alabama. He remarked in his autobiography that if there was anything I hated, it was investigating the organs of the female pelvis. When an enslaved woman was brought to him with an injured pelvis from a fall from a horse, he placed her in a knee chest position and insert his finger into the vagina. This allows him to see the vagina clearly and inspired him to investigate fistula treatment. Soon after, he developed a precursor to the modern speculum using a pretuous spoon and strategically placed mirrors. Sims was not the first to successfully treat a vesico-vaginal fallus. However, he was preceded by Dr. George Hayward in 1839 and John Peter Martner in 1838. Henry Van Roonhouse, clinical trustee, entitled Medical Chirurgical Observation, outlined exceptional repair steps that are recognizable today. From 1845 to 1849, Sims started doing experiments on enslaved black women to treat vaginal problems. He added a second story to his hospital for a total of 8 beds. He developed techniques that have been the basis of modern vaginal surgery. A key component was silver wire, which he had a jeweler prepare. The Sims vaginal speculum aid in vaginal examination and surgery. The rectal examination position, in which the patient is on the left side with the right knee flexed against the abdomen and the left knee slightly flexed, is also named for him. All right. So this is the instrument tool they use to open up the vaginal canal with. Okay. Now, they do have the metal kind, and it's the kind they use now is more upgraded. It has like a little handle at the end. So when they insert it, they use the little handle to like open it up. Okay, they make it easy to open it up. So it's not like the picture I just showed. So they have the plastic kind, and they also have the metal kind. So the metal kind is the one that hurts the worst, and it's cold. Okay, but the plastic kind is much better and is a lot safer, because at least when they put it in you, they have to dispose it afterwards. So you know that, boom, they ain't using it again. They open it out the package. Once they open the package up, they use it and then they dispose the package, and then they get a new one. So if you ever, to all the females out there, if you ever go to your gynecologist, right, ask them to use the plastic material for your pap smear. Do not use the metal kind, because with the plastic material, it's in the plastic. They can open it up, they can insert you with it, do what they got to do, and they can dispose it. So that's a lot safer. So it's best to get the plastic kind versus getting the metal kind. All right. So that's what I recommend for women that's going to get their pap smear. So that's all I have for this subject. I didn't even want to go any further because I don't care too much for the man. I don't know why people celebrate him. What he did was very unethical, and he caused many deaths on enslaved. What he did was unethical, and he caused many deaths on slave women. And so I don't care to really celebrate him or whatnot, but I just wanted to give a little bit of background about him. Again, these are the most toughest subject I have to do. This is the most toughest subject I ever spoke about, especially sterilization. It was very tough, and the whole gynecology thing is what really got to me. So, you know, by me being a female and just reading up on this information, sharing with the people out there, it was pretty hard for me to do so. But yes, next time I am going to do a topic strictly on abortion. Strictly on abortion. And we're going to come back to the Planned Parenthood too, okay? Because we're going to revisit that. We're going to focus on that topic. So be ready, be prepared. I know people going to have their opinion and their views. They're going to jump on here, you know, giving their commentaries or whatnot when they ain't comment on the video when they was watching it. So they going to jump on here giving their little commentary. So I'm going to be prepared for that. So I'll let people know when the subject is going to come into place, when I'm going to be talking about abortion. All right. But until then, you guys have a good one. And you guys be safe. Until next time, peace and power elevation. Please check out this channel. Subscribe to the channel. Check out the video. Share the video contents and all that stuff. And I'll make sure I share some of the sources on my page. If you guys follow my Facebook page, which is Tiffany French. If you follow that page, I'll make sure that I'll post some information on there for you guys. But until then, this your girl Tiffany. I'm finna log off. And I'm saying deuces. All right. Peace.